Pharmacist is the third most trustworthy person in Canada among healthcare professionals. So this is my second question, actually third question to you, about whether the vaccinating and introducing the service in the pharmacist could build up the position of the pharmacist. From your experience, what do you think about that?
Yeah, definitely. I really think that increases the point of contact between the patient and the pharmacist. It also gives the pharmacist an opportunity to ask about other medications that the patient is taking, or see how their overall health is doing, and step in if there's any issues that the patient is having. So I really feel like that's a good way to build that foundation of trust.
Wow,
Yeah.
This is very interesting as well. Just additional question, because I know Alberta is special about the scope of practice. So could you just tell me more about what you're doing briefly, and because you actually do a wide range of services that it's different towards other sort of states in Canada.
So I would say I am blessed to have a pharmacy license within a province that has really expanded the scope of pharmacy practice to its fullest extent. Once a pharmacist has practiced for at least a year in Alberta, they have the ability to compile some cases as well as justification as to why they would like to have APA, which is Additional Prescribing Authority. So if this is submitted to the college, it is adjudicated and kind of evaluated. And if you're deemed competent to be a prescriber, then you get this APA designation. With that, you're able to prescribe prescription products, excluding narcotics and controlled substances, which I think in the opinion of most pharmacists is just fine.
Excellent, thank you very much. And another question is about how does the process of vaccinating the patient looks like in Canada? If you could just tell me a few things about the qualification test of the patient, prescribing process, and who vaccinates who, basically pays for the service.
So because it is an intervention from the province, the pharmacist can bill directly to the province, and then they get reimbursed for that. But basically, the patient would come in and say, "Hi, I would like my flu vaccine today." And depending on the schedule of the pharmacist, they would probably say, like, okay, it'll be about 20 minutes or so. And then they have to fill out a form and get the patient to sign the consent form. And then from there, they go into a counseling room, which is a very confidential area, to provide the flu vaccination.
Mm-hmm. What is in the form that the patient has to fill? What kind of questions are there, basically? Just because you have to perform like a pre-screening, yeah?
Yeah, so it depends on the vaccination. So some of them are specific. If it's flu season, there's a specific flu form that their province has. And so that form asks them kind of, are you feeling well today? Are there any previous history of having any reactions to any vaccinations? And the part that's in text is more just consenting to the actual procedure, because we can't perform a procedure without the consent of a patient.
Okay. Another question is about what kind of vaccines actually are provided in Canada. If you could just mention a few of them, please.
So within Ontario, our scope is a little bit more narrow, but we can provide the flu vaccine, and then we're on our way towards travel vaccines.
Okay. And is it free of charge, or you have to pay for that? Or both?
So the flu vaccine is free of charge because that's through the provincial government, but the travel vaccines, the patient has to pay.
Mm-hmm.
Yeah.
Jen, just a question to you, because I've heard that you mentioned something that you not only provide vaccines to the patient, but also to the staff in the hospitals.
And maybe I'll add on to what Selena has. So in Alberta, we provide many types of injections. So not limited to just vaccines and not limited to provincially covered vaccines. The pharmacist will also administer vaccines that aren't covered, for instance, like Gardasil. We also administer injections like vitamin B12 injections that are done on a monthly basis. And that was true for Manitoba and Alberta that I have lived in. In the hospital setting, so for me to maintain my license and my competency, I need to administer vaccines at least annually, or at least administer injections annually. So within the hospital, we run clinics for the staff. So this helps all of our staff because we know that even though they might not have influenza-like illness, they often will have the kind of viral serology. So we know that we need to vaccinate our staff to keep our patients safe. So we offer vaccine clinics usually for about a 2-week period. We don't offer anything aside from the influenza vaccine. However, we do ask different questions, and if they are deemed to have needs beyond just influenza, then we will tell them to go out to kind of a community pharmacy and receive those vaccines, like for pneumonia.